come in.
Hi, I'm Talina. I'm going to be a USA College of Nursing student today doing a head-to-toe assessment for your head and neck system today. Is that okay?
Mm-hmm.
All right, very good. So the first thing I'm going to do is I'm going to inspect your head. Your head appears normocephalic. I noticed that your facial features are symmetrical. Your eyes, your ears, your nose, your mouth, your palpebral fissures, and your nasolabial folds are all present and symmetrical. Okay? So the next thing I'm going to do is I'm going to palpate your scalp. Is that okay?
Mm-hmm.
All right, and you just let me know as I palpate if you're feeling any tenderness or discomfort. All right? So I'm going to palpate your scalp. All right, I don't feel any lesions. Your scalp is clean and dry. Your hair is brown and appears to be straight. I don't notice any lesions or pest infestations, okay? Did you feel any tenderness as I was palpating? Very good. Okay, so now we're going to move on to cranial nerve 5, and this is going to be the trigeminal nerve. And to assess this, first what I'm going to do is I'm going to have you clench your jaw, and I'm just going to palpate. Okay, so that's equal and symmetrical. And now I'm going to pull down on your chin, continue to clench your jaw. I'm going to try to open your mouth, okay, and just resist me. Very good. Okay, so the motor portion of cranial nerve 5, the trigeminal nerve, is intact. Now I'm going to perform the sensory portion. So I'm going to have you close your eyes, and I'm going to touch your face in 3 areas, and I just want you to say now when you feel me touch your face, okay?
Now.
Very good. So cranial nerve 5, the trigeminal nerve, is intact. So now we're going to move on to cranial nerve 7, which is the facial nerve, okay? So I'm going to have you make a bunch of funny faces, okay? So smile, frown, puff out your cheeks, raise your eyebrows, and close your eyes really tight. Very good. Okay. So the motor portion of cranial nerve 7, the facial nerve, is intact. Now we're going to move on to the sensory portion, which I'm not actually going to perform today. But if I were going to perform this portion, I would give you a sweet, salty, or sour taste. We'd put it on the anterior 2/3 of your tongue, and I'd have you identify it. But like I said, we're not going to do that today. Okay, so now we're going to move on to the nose, all right? So your nose is midline. I'm going to look at your nose really quickly. Can you lean your head back for me? Your septum does appear to be deviated. I'm not able to visualize your turbinates, and I don't see any polyps, and your mucosa is pink and moist, okay? So what I want you to do is just let me know. I'm going to palpate your nose. Let me know if you feel any tenderness, okay? Do you feel any tenderness there? Okay, very good. All right, so I need you to occlude one side of your nostril and sniff. Okay, occlude the other side and sniff. Okay, so now I'm going to have you close your eyes, and I'm going to have you occlude one side of your nostril, and I'm going to place a scent under your nose, and I want you to identify it. Okay, what does that smell?
Peppermint.
Peppermint, very good. Okay, let's do the other side. Okay, sniff.
Alcohol.
Very good. Okay, so you correctly identified the 2 scents that I placed under your nose. So we're going to say that cranial nerve 1, the olfactory nerve, is intact. Okay, so now we're going to move on to your mouth and throat. All right, so we're going to use my pen light. I'm just going to look around in your mouth and throat. All right, so your lips, they are pink and moist. Can you open your mouth for me? Your buccal mucosa is pink and moist. Smile for me. Let me see your teeth. Very good. So your teeth are white and straight. Your gums are pink and moist. They have good tight margins. Have you had any teeth removed? How many?
Teeth. 4.
4 wisdom teeth, okay? So the normal adult has 32 teeth, and since you've had 4 wisdom teeth removed, we're going to say you have 28 teeth, okay? All right, can you open your mouth again and lift your head back for me? All right, so I am able to visualize your hard palate. It is anterior and white. Your soft palate is posterior and pink. So look at me and stick your tongue out and say ah. Okay, so your uvula rosal phonation, your tongue is midline. It's pink and moist. Can you touch it to the top of your mouth for me? I do notice veins underneath there, but I do not see any lesions. I said your gums. Now I'm going to look at your tonsils. Do you still have your tonsils?
No.
Okay, so your tonsils are a 0. Okay, so they're not present. All right, so now we're going to move on to your neck. So for your neck, I'm going to be palpating a lot of lymph nodes in your neck. And I basically just want you to let me know if you feel any discomfort or any tenderness, okay? So I'm going to start with the preauricular nodes, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, and can you hunch your shoulders for me? Your supraclavicular. Okay, did you feel any tenderness?
Mm-hmm.
Okay, and those were non-palpable and non-tender. All right, so now we're going to move on to the cranial nerve 11, the spinal accessory nerve. So what I'm going to have you do is I'm going to put my palm against your face. I want you to turn your face against resistance, and then I'm going to have you raise your shoulders against resistance, okay? So just turn your head. Very good. Do this side. Very good. All right, and then lift your shoulders. Okay, very good. So your spinal accessory nerve, cranial nerve 11, is intact, and that concludes my head and neck assessment. Did I leave anything out?
Yes.
What?
You did the eye. I know you're supposed to.
You don't have to do that part. Yeah. How long did that take me? You don't have to, but you can. How long did that take?